this in the city, what's happening, and kind of what folks can do about it. Just a little bit about me. My name is Miguel Guadalupe. I am a VP of Development. I came to BRC in 2018, came from the private sector into the development, which is about fundraising and gaining support and supporters for the mission. Grew up in the Bronx, went to school in the Bronx and Manhattan, and eventually college in Connecticut, and came back to the city to do the needful. So happy to meet you all. Hope, looking forward to all your questions. And let's just jump into, I guess, what BRC is. So BRC was actually started in 1971, so we're over 50 years old. And the Bowery, so it's the Bowery Residents Committee. If anybody was around in the 70s, knows that the Bowery wasn't the place of luxury apartments and Starbucks on every corner like it is now, right? The Bowery was the Skid Row of New York City, right? Think Gotham City, think Under the Bridge, right? If you were down and out, if you were, sort of down on your luck, if you were housing insecure, if you were if you were an inebriate, which is what they call people who had chemical addiction back in the day, that's usually where you were going to be in the Bowery. And what used to happen down there was that developers would basically build these huge rooms. They build these huge warehouses. They call them flop houses. And for a couple of dollars a day or a couple of dollars a week, you could sleep there. But it wasn't much to it. You basically had like a cubicle amount of space where you'd put all your possessions. Maybe there was a bed there that you could squeeze in. Most likely it was a mat on the floor or a couple of blankets. No privacy, maybe a bathroom on one end, open air, chicken wire on the top, so that the air can come in, but there wasn't much privacy. And that's where a lot of folks would end their days and begin their days, is in these flop houses. And it was pretty bleak. So what ended up happening is that a couple of the folks who actually lived in these flop houses then decided to come together in solidarity to help each other out. They knew that if by themselves, they probably wouldn't be able to make it, but maybe together they could keep each other sober, they could keep each other stable, and they can get to a point where they could get out of the flop houses and restart their lives, right? And so with the help of some social workers, I believe they were from Columbia University, they formed the Bowery Residents Committee. And the Bowery Residents Committee in the beginning was just to give people in the flop houses something to do other than just be in those cubicles all day. So it started out with a recreation center, and in the recreation center, they started to add social services, and they really started to get folks, try to get folks clean and sober, and the rest is history, right? So that's where BRC is from, and I like saying this because it's a unique founding of an organization like ours. It actually started very much from the ground up. It was founded by the people that we consider to be clients today, right? So a lot of organizations are founded by well-meaning philanthropists who see a problem and want to help it in any way they can, but maybe are distanced from actually experiencing the problem. BRC was founded by those who were really living it day to day. And what that means is that philosophy, that care, that empathy has grown with us as we've moved for 50 years and grown from a small community group in the Bowery to 35 programs throughout the city, all the boroughs except Staten Island, servicing over 12,000 people a year in 35 programs, and not just having that recreation center, which is actually now a senior center for seniors who are food insecure in the Bowery. If any of you pass by Roosevelt Park by Chinatown, you'll see that building. That's one of our original buildings. We still have it. But really, it's about standing side by side with our clients, not telling them what they need, but really walking side by side with them on the path from homelessness to home, and meeting them when they're at, and making sure that they're always moving forward, right? So I could go on and on about the statistics, but what I really want to do is show you a video that I think encapsulates perfectly what we do. It's a really great story about one of our clients named Dumar. And I think we could start talking about the logistics, et cetera, about homelessness afterwards. But I think this video in particular is going to answer a lot of the questions that you may have already. So, Sean, you ready?
Excellent. And please, everyone, let me know if you hear it once we start playing.
BRC's main approach to doing outreach is meeting the service users where they're at. As a BRC outreach worker, we try to really treat them with respect and dignity as people. If they don't want to talk to us at that time, we don't push anything, but we make sure we take note of that and try to build rapport and keep coming out and engaging these individuals until they feel comfortable sharing their stories with us, and then we can share our services with them.
BRC's approach towards clients is we like to say a hand up and not a handout. But a lot of that is giving tools. So it's helping clients with the tools they need to navigate their world to reach the goals that they set for themselves. I think one of the most important parts about working at BRC is that the goals are the client's goals. They are not our goals.
Meeting the client where they're at.
Yeah.
Just, letting them speak their mind before you interact with them, just hear them out first.
Right. How can we help you to navigate in the society that we have that isn't always built to accommodate or accept? And we do that with radical acceptance and radical non-judgment and just complete, we are going to care for you when other people can't. And we're gonna show you that dignity and respect when other systems won't. And so that means we're gonna work with folks that are gonna be challenging for other people. BRC is gonna be there to be that safety net and catch people with love, with care, with concern, treat folks with dignity and respect, and use all the creativity and competencies we have to help move folks forward.
Well, I grew up very, very well. My mom, her name was Yvette Scott. She raised me very well. She taught me lots of good things, but unfortunately now she's in heaven with the angels. So she watches me every day. And ended up living in an apartment at first. Then the rent got too expensive, and then I was put out of the apartment. I was on the street 7 years. And I'm not gonna lie to you, I never thought I would get off the street again. I thought I was gonna die on the street. But BRC gave me hope.
Upon meeting Dumar Scott in Penn Station, my first impression was a very motivated person, very independent despite being mobilely challenged in a wheelchair. So he's just a good guy. Listening to him and what he wants as a person, he didn't want to be in a nursing home. And right off the bat with me, that was one of the things he told me, I don't want to be in a nursing home. And I just didn't want to, you don't want to force that on him. It's his life, his decision.
All Dumar wanted was a place of his own. He wanted a roof over his head. He wanted a door for privacy, a place where his family could freely come and visit him, and a place where he could live independently. Anyone who could go through the challenges and the trauma that Dumar faced after losing his mom was someone that I knew could be successful in a housing situation.
BRC is a true example of things that can and will happen, but you have to apply yourself. You can't be one of those people that go, woe is me and this is that. Because the one thing I would like to tell you is, no matter how bad your day is, it gets better tomorrow.
I think the average person doesn't quite understand what it's like to watch someone move into housing. And so they don't appreciate how many times a year we get to watch people get their keys and move on and get a life back that they deserve. And that's what people don't get to see when they walk down the street. What you see is all of the side effects of the racism and the poverty and the classism. But what we see is when that ends. We see all the individual cases when people move forward. And that's what keeps us going forward.
Thank you for showing that, Sean, and thanks everyone for the patience of looking through. I know it's a longer video, but I think it encapsulates a lot of what BRC is and kind of the work that we do. So there's a lot of topics that got touched upon in the video. One is this idea that how are people becoming homeless, right? How is this even happening? Why are we seeing people in the streets more? And there's a lot of academics who are writing even now about this, right? And I think people are going to have a better answer as the years go by and they're able to look at this. But the reality is the number one, and this is the stats from the Coalition from the Homeless, so not even BRC, but the primary cause of homelessness is affordable housing. In this city, you know, for the working class or the working poor and those who are below a certain means, getting cheap, affordable housing is nearly impossible without assistance, you know, not on your own, right? The rest, it's very, you know, we see symptoms. A lot of times people think of it as, oh, they're homeless because they're addicted, or they're homeless because they're doing something wrong. The reality is that a lot of the addiction that you see is not the cause of their homelessness, but a symptom of coping with homelessness. You know, yes, addiction plays a part to people potentially not paying rent or being able to, you know, move forward. But a lot of that times addiction is a self-coping mechanism. It is true that much of the street homeless that we see, folks have some type of mental illness. It's a very high percentage of individuals who are what we call street homeless, or folks who are sleeping on the streets, are dealing with some combination of mental illness and chemical addiction. Oftentimes that chemical addiction is to self-medicate or to deal with the mental illness. So that's kind of what you're seeing, you know, on the streets. But the reality is that there's hundreds of thousands of people who are homeless or they say home insecure in the city, and their families and couples and young people. There are a lot of people that you don't see because they're sleeping on a couch in a friend's home, or they're at a family shelter, or you know, they're at a working men's shelter. So they look fine. They're going to work every day, but at the end of the day, they're going to their shelter because they're not able to find an affordable place to live on, you know, on the salary or the revenue that they bring in. So that's kind of, you know, some of the causes. What does groups like BRC do? So BRC is, for lack of a better analogy, the emergency room for homelessness, right? Homelessness comes from multiple institutions that are much bigger than what BRC is. It comes from broken systems that include our healthcare system, that include our mental health system, that include our justice system, that include our education system. It includes all these major systems and institutions that allow people to fall through the cracks. And what BRC does is we try to provide a safety net for those who are falling, right? Most of the time, homelessness, you know, is about a network of support. You know, how do you fall through those cracks? And what's the difference between someone who ends up on the street versus someone who ends up sort of bouncing back? And that's resources. That's a network of people who can help you, right? I'll give you an example. When I was young, my mother was diagnosed with breast cancer and had to be, you know, interned in the hospital. And this is a long time ago, before, you know, medicine is what it is today. And she was on leave and she wasn't getting paid, and we lost our apartment. But I was able to go to my aunt. Well, we were able to stay with our aunt, right? What happens if there was no aunt? What happens if there are no relatives? What happens if there are no friends that can open their doors to you and bring you, you know, bring you the resources that you need to sort of bounce off of your feet? And that's sort of where BRC comes in. BRC becomes that network, that resource, that catch when folks are falling, to try to stabilize them, get them ready, and then hopefully move with them forward. So, you know, so that's kind of where we are. I can give you some stats. Last year, and it'll give you a good sense of kind of where we are. We served over 12,500 clients last fiscal year 2023. Our fiscal year is July 1st to June 30th. That's the most we've ever in 5 years. On a daily basis, we're serving about 4,500 people a night. That's also the most we've serviced in the last 5 years. Our clients are 87% male, with about 13% female and 1% transgender. And they range in terms of age is actually, what's interesting, this has changed a little bit. It was mostly 50 plus, but over the last year, we're 40% in the 31 to 49 range, 37% 50 plus, and 23% 18 to 29. In terms of our clients, what do they look like? And this is, again, backed up by numbers from the the New York City Homelessness, from the Coalition from the Homeless. It's mostly Black and brown men. 35% Hispanic, 47% non-Hispanic Black. And then, we're looking at about 18% multiracial, Asian, or non-Hispanic white. So this, homelessness disproportionately affects Black and brown people, and disproportionately in terms of street homelessness, men. Why is that? Well, because a lot of times these individuals are coming from what we call a forensic history. They're coming from the justice system. They're coming from, there's some mental health issues. And the reality is that there's not a lot of resources for individual men. We come up with this all the time when we try to open new shelters. We get a lot of pushback as soon as you say this new shelter is going to be for men, for single men. If we say it's a family shelter, it's a different story, right? But as soon as you say it's going to be for single adult men, all of a sudden we get pushback from neighborhoods, from community boards, from folks, because all of a sudden they're afraid. And that makes it a lot harder for individuals like the people you see on the screen. If we ever were to need resources, where do we go? Where do people like us go? And BRC has stood up and answered that call and said, you can come to us. So yeah, I just want to talk a little bit about kind of how we're doing. Last year, again, the most we've ever in the last 5 years in terms of 1,000 housing placements. That means folks coming out of shelter and being put in permanent housing, and the most since COVID in terms of job starts and employment, which is hard for our population of individuals to find a job, especially off of COVID. That devastated a lot of the jobs that many of our clients ended up going to. So, that's what BRC is doing. We are, again, all over the city, 35 programs. Our programs range from outreach, which you saw in the video, where we're out there looking for people who are street homeless and how we can help them. And then we do many programs in between, like stabilization, safe havens. We can go into that a little bit. We do drug treatment. We do, we help folks with what they call major medical issues. And then we do workforce training programs and supportive permanent housing. And we do follow-up visits, and we make sure that the folks that leave our shelter aren't forced to come back. So we help with rent, and we help with if they lose their job, and retention is key to part of our programs, to make sure that we're making them, we're not just getting them housed, but we're giving them the skills to maintain their status of being in housing and being able to live on their own independently. So I'll pause there. Any questions for anyone? Panel, chat, etc.
Absolutely. Before we open it up, and I'll actually hand it over to Frank, we did have some people in the chat really loved that video. It was very moving, very powerful, tremendously powerful from Alex. Miguel, I just have to say, doing this work and the position that you have, it is amazing to see. And, I wish you all of the strength and success in this work. I mean, it's one of those tough areas where I think a lot of stigma is around homelessness. I mean, even just the wording around how do we identify someone living without housing, whatever term you want to use. I think the most important thing, and it was even in the video, was meeting people where they're at. And that's one of the things that we've definitely strived for here at the Heritage of Latinx Alliance. With that, I am going to pass it over to Frank. Frank, you let me know if you want me to manage the Q&A or however I can help.
No, yeah, you can manage the Q&A, and I apologize to everybody, but you know, technical difficulties happen, and this was one of those instances where it happened. But you know, that's why I got a partner. Right? That's why I got a partner. So we keep the show moving. Actually, what I wanted to say, you know, when I wanted to do the introductions, and I don't know, you know, what was covered in the introductions, but I wanted to remind folks that that we are partnering with BRC. If I recall, this is like for the 4th time, right? I think we partnered for a purse project in 2018 where people donated purses and we filled them, you know, and we filled them with toiletries. In 2020, we did Care for the Homeless, again with the same thing where we collected toiletries, shampoos, lotions, gloves, socks, et cetera, et cetera. And then in 2021, we did a Share the Warmth drive where we collected hearts, scarves, hat scarves, and earmuffs. And this year, you know, we're proud to bring back somebody from BRC and Miguel, again, to talk about and share with us what homelessness is, or the unhoused, and the fabulous work that BRC does. So those are just some of the points that I did really want to make early on. So again, I apologize for the technical difficulties, right? But also to announce that after today, we are going to proceed with what we're going to what we're calling Be Kind Drive, where we're also going to collect donations. This time around, we're actually more advanced, right? And so you'll see, you know, look out for the flyer, look out for the email where there is going to be a QR code that you can scan, and it goes directly to the Amazon website. And from there, you can select what are the needs that BRC has that you can donate. It'll go directly to them. Some people like to hand it in person. Look out for the flyer, because you can either drop it off in my office or Sean's office, but we'll give you a drop-off location. But I wanted to make sure that you all knew that that is coming, because we first wanted to have Miguel speak so that we can all understand, you know, the great work that BRC is doing, you know, with the hopes so that you know where your donations are going and how it is that they're helping. With that said, if there are any questions, Sean, you can take over the question and answer.
Absolutely. So first question was, could you talk about the BRC model used for mental health services provision and the sustainability of these services?
Right. So, so I'm not a clinician. I'm in the development team. So I'm in the ivory tower. So I can't tell you in terms of sort of industry speak, kind of what our process is. What I can tell you is in all of our shelters, in all of our safe havens, in all of our stabilization programs, we have clinicians and social workers whose job it is to make sure that all of our clients are getting the services that they need. We don't actually do a lot of those services in-house because we're not a hospital, we're not equipped with that. But what we do is we will make sure that they're going to their appointments, that they're seeing their therapists, that they're seeing, we do have drug treatment centers, right? That we do have. But you know, that they're going to their drug treatment centers if it's not a BRC center. We'll take them in a car. We'll make sure that they get up. You know, we say, Mr. Guadalupe, I know you have an appointment today with your doctor. You know, do you need a Metro card? Do you need me to take you? You know, let's go. So we're making sure that we're providing that resource of getting them where they are. We also make sure that that they can pay for it, right? So a lot of folks don't get their services because they're not on Medicaid or Medicare or some type of entitlement service that pays for their health care. So our clinicians will make sure that they're set, whether it's veterans benefits or Medicaid or SSI, whatever it is that they need. We work with them, and sometimes it's very hard because some folks coming out of the street don't have ID. Some folks don't even know really. Sometimes you forget if you've been suffering from mental illness for a very long time that's untreated. Some folks don't even really remember who they are or where they come from. So we do a lot of investigative work in terms of trying to ID individuals, trying to find their birth certificates, trying to find their last known addresses or where they come from, so that we can begin filling out the paperwork so that they can get the entitlements that they deserve. And then we also have folks on site. We'll have a nurse practitioner. We'll have licensed art therapists. We have we have folks who are trained in understanding the needs of our clients. And if there needs to be an intervention, they're ready to do that. No one is ever left on their own. No one is ever left. It's always, all of our programs are staffed 24 hours a day. And so what we do is we help them, get to where they need to be, one step at a time.
Thank you. And I know that's a great question. We're always concerned about, what services are out there for the neurodivergent community. So that was a great question. Similar along the same lines. I know you're not a clinician, but it's great that you're doing this talk, right? Because there's maybe clinicians on this call right now. Make sure you
That's right.
Yell after this, right?
Right. I don't want to say that we're hiring or anything, but
Yeah, absolutely. But there was a similar question along the lines of cancer screening tests in this community and what resources are used to cover that treatment.
Right. So that's a good question. And I can tell you this, like unfortunately, the unfortunate statistic is this: when folks pass away, when they're suffering from homelessness, the majority of the times it is not because they starve, right? A lot of people think, oh, let me give this guy a sandwich because he's going to starve. It's not because they starve. A lot of times people are like, oh my gosh, it's cold out there. It's usually not because they freeze, even though they are exposed to the elements. It's usually because they are not treating a disease or an illness or a chronic situation that is absolutely treatable, if not preventable. When you are out on the street and you're struggling with mental health and you're struggling with chemical addiction, you're not getting treated for diabetes, high blood pressure, cuts, infections, wounds, gangrene. You're not being screened for cancer. You're not, getting to the help that you need because you're not being monitored by someone who can see those signs. At BRC, we make sure that we understand that. So we invite, we do have we have nurse practitioners at certain locations that monitor people's health, their blood pressure, et cetera. But more than anything, we make sure that folks are getting the medical attention that they need. Again, going to their doctor, going to their therapist, going to their programs. I'll give you an example. We had an individual that we got a complaint about, right? We got a video and the individual was peeing in somebody's doorway. And the community neighbor was super incensed. And I think there was I think somebody posted it on YouTube. It was like the BRC peer or something like that. And we looked at the video and we knew who the person was. And we went to the person and I'm just going to say Tom for lack of another word. We're not going to say his name. And our clinician went up to the person, and because they're trained on how to engage them, Tom, how you doing? How's everything going? No, I'm good. Everything's fine, right? A lot of folks have a lot of pride, so they're not going to tell them, oh, I just peed over there. And so very calmly they'll say, listen, we got this video. We want to show it to you. And you let us know what you think about it. And we showed them the video that we got of someone who had recorded him. And of course, the gentleman was very embarrassed and very apologetic. And he said to us, well, the problem is that I can't wait anymore. And I've already gone through 2 pairs of pants and I didn't have any more pants, right? And I didn't want to be embarrassed walking through the halls with wet pants again. That turned what could it, what most people think is just people being dirty or gross into what we knew to be a medical situation. So we said to him, you need to be evaluated. And we brought him to the hospital. He was evaluated. It would turn out that he had to get, we don't talk about medical conditions. He had to get medical attention, and we saved his life. And it was because we understand the individual of who they are, and both in the good, and we can tell when there's something changing, that we can intervene when we need to. So yeah, so we do a lot of that. We do a lot of interventions. We do a lot of, we don't do the screenings because, we're not doctors, not a hospital, but, we make sure that our clients are getting the medical attention that they need.
Excellent. That is great to share. Thank you for sharing that. And I think it's that level of awareness that really contributes to the type of program that you all have. And next question we have, first they're saying, thank you, BRC's work is inspiring. Can you express what are some of the pressing challenges BRC faces in the coming months or year, and how these challenges have evolved over time in New York City?
Yeah, I think that's a very good question, and thanks for asking it. COVID showed a lot of the, I guess, chinks in the armor that is New York City, right? There were a couple things that it exposed or brought to light that we always knew, but it was definitely something that very much became acute. One was the ability for the city, to really help us with the housing affordability issue in the city. That is probably the number one reason why folks stay in shelter longer. It's probably the number one reason why folks don't go out of shelter at all, is because there's nowhere for them to go. And so one of the things that BRC has actually started to do, and we've done it successfully a couple of times, is we're actually building our own housing now. We were able to fundraise a lot of private money through grants and foundations and individual donations to purchase land and develop our own land. And develop our own building. If you guys are for those of you who are familiar with the Bronx, if you know where Salsa con Fuego, the old Jimmy's Bronx Cafe is, well, behind it is a brown and orange building. That's BRC's building. And what we did is we bought the land and we developed it where it's a shelter, 200 men's shelter on the bottom, working men's shelter. And then on top are 135 units of truly affordable housing. It's a bunch of studios, 1 bedrooms and 2 bedrooms. The studios are all for people coming out of shelter. That's reserved for them. The 1 bedrooms and the 2 bedrooms are reserved for folks actually in the community, as well as anyone else coming out of lottery, right? And if you guys are familiar with the lottery, you have to be below a certain medium income, you qualify, and then you hope that the lottery picks you and you get access to the units, the 1 bedroom and the 2 bedroom units. That experiment, because this is pure innovation, to be able to do a multi-purpose building like that has been a resounding success, both because it provides the emergency help, which is the shelter, and it's providing housing on the top for those coming out of shelter, as well as those who are housing insecure, and that's our first take on that. We're doing the same exact thing in Queens, but it's going to be a women's shelter on the bottom with housing on the top. And then we're also purchasing land in Manhattan to do single shelter. So shelter, just the building, the shelter, as well as in other places. So that's how BRC is answering the call. But really what we need to do is we need more of that. We would love for a bunch of nonprofits to start building buildings that are to answer a problem as opposed to gain profit, right? Because BRC is a nonprofit organization. So any money that we get from the real estate part, from being a developer, we pump back into our programs, right? As opposed to, say, a profit developer that are putting in their pocket or sharing it with shareholders, right? We need more of that. The second thing I think would be we need a little more, just I guess, understanding about what mental health is and what it is not, right? We saw a lot. We saw the terrible story of the individual who was murdered in the subway system after he was having a mental episode. We have to understand that confrontation for individuals who are doing that is not the way to go. And a lot of it comes with education. A lot of it comes with empathy, right? I think New Yorkers do have a lot of empathy. They understand. You can tell that they understand what a situation is and what it means to help someone and what it means to just kind of let them, do their thing. And we can't turn into a city that is, sort of vigilantism, where it's like, oh, it's up to me to solve the situation. We really need to make sure that we're approaching these situations with empathy and with real view of what the problem is. In terms of that, I mean, that's just kind of what's coming out of my head.
No, I think that's a great answer. And I love the word you use, understanding. And I'm maybe putting you on the hot seat, probably won't, right? I'm on this call, we're having this conversation, and everything you're doing about setting up housing for individuals without housing sounds great. But now the sign comes up in my neighborhood that BRC is building a shelter in my neighborhood. How do you get those people in that community to get that understanding that how important this is versus their own perspectives about this shelter coming up in their neighborhood?
Sean, I got to tell you, that's probably the hardest part of my job, is educating folks whose natural first reaction is fear. And like I said earlier, it's one thing to know that it's a shelter. It's another thing to know that it's a shelter for men. It's another thing to know that it's a shelter full of brown and black men, right? And I think that those degrees of fear tend to rise as that information starts pouring in, unfortunately. What we do is we just engage and we listen. We listen to people's fears. We're doing a project on Amsterdam and 145th Street, actually with H&H, where we're partnering with them to give housing for folks who are coming out of the hospital system. So H&H, you guys all know, is like Lincoln and Harlem Hospital and Metropolitan. We've got a lot of folks who are suffering from mental illness who keep coming in and out of the hospitals. And I'm sure you guys understand this too, because they don't have nowhere else to go, right? So they go into the emergency room, they stay there for a couple of weeks to treat whatever illness that they have, or because they had an episode, or because they, their asthma kicked back in, and they stay in a bed. They're taking up a bed. Nobody really needs that. Nobody wants that. COVID showed that about how many people were taking up beds. And then they're dismissed. And because they don't have nowhere to go, they're back a week later, right? So these repeat, residents are not getting better. So what H&H and BRC is doing is we're partnering to solve that problem, because housing is health and health is housing, right? We looked at a site that they owned on 145th Street in Amsterdam. It's underutilized. There's a couple programs that are there. One that's actually, super important, and that's coming, that our plans are for them to come back. There's another one who they're really great people. We intend to use that to create permanent supportive housing for folks coming out of the hospital system, so that they have a place to go, and they're also being supported so they can continue to get better, to handle their mental illness or whatever it is that they're having, deep medical issue, whatever it is. Just the word supportive housing, people's hairs stand up, right? The first thing that people think about, of course, is, the children. And I get it. I'm a dad. And that if there's someone there with mental illness, and that immediately translates, and let's be real here, everyone first thinks pedophilia, right? So what about the children, et cetera? There's a school. You have to educate folks. You have to say, well, guess what? The law is, if you can't live by a school, you're not going to live by a school. Doesn't matter whether it's a BRC facility or your own apartment building, right? As a matter of fact, if your building isn't by a school, it's more likely that someone who is a sexual offender is living in that building than will be in the building that we're building, because it is by a school, right? And there's multiple screening levels that ensure that, right? And so a lot of it is education, a lot of it is listening, a lot of it is understanding. We don't have to agree, right? And that's a great thing about the city, and it's a great thing about being in a democracy, is that we don't have to agree of what the solution is going to be. The city has its priorities, and its priorities is to start housing people because it's a crisis. And what we do at BRC is we want to make sure that we're good neighbors. So we have a good neighbor policy. We have 24-hour service. We work closely with the local police precinct. We do community boards, community advisory councils that we meet with quarterly to make sure we're addressing anybody's needs. And of course, if there's ever a situation, we're on it super, super fast. And we've been able to live in a lot of different communities, whether it's Harlem, the Bronx, Queens, Chelsea. Our headquarters on 25th Street in the middle of Chelsea. We're on the Upper East Side. We're on the Upper West Side. And so we're able to live in these communities because of the way we approach both our clients as well as the communities that surround them.
Thank you so much, Miguel. I know that's a tough situation to be in, but I think everything you said was spot on. I'm going to give you one more question, and then I think it'll be good to just tell everybody how they can get involved more with BRC, and then I'll pass it to Frank to close us out. Now, this is a really good question. Helping people is very rewarding, but how do you cope with seeing the struggle without it affecting you mentally or emotionally?
I think that is a really great question. And I have to say that, again, I'm privileged in that, I'm more on the administrative side. I'm not on the front line. And most of our staff are on the front line. And they have been dealing with the pressures of working in the shelters, working with shelters, working with very clients with a lot of needs. And they did it throughout COVID. You can't do this remotely. They did it throughout the pandemic. They do it now. It's 24 hours a day, 7 days a week, rain, sleet, or snow. Somebody's got to be in those shelters. Somebody's got to be in those programs. And so they are. They are in essence, they are the same as first responders, because when everyone else was going home, like myself, and setting up their Zoom calls for meetings, they were in those shelters working with our clients, making sure that they were safe, they were secure, and they had somebody to look after them. It does take a toll. One of our challenges is definitely turnover. That's the reality for anyone in this industry, in this human services industry. Turnover is an issue. We do a lot of mindfulness training. We have our Department of Equity is in charge of that internally in BRC. We do staff appreciation events, including their families, which we include their families in. And so we try very, very hard to take care of the people who are taking care of our clients.
Miguel, it's been great learning so much from you. This is a great conversation. I want to thank you. I want to thank Frank's technical difficulties for allowing me to fill in and have this Q&A with you. So with the last couple of minutes, if you could just quickly tell everybody how they could get involved, even if you want to share the link to BRC in the chat for them as well, I think that'd be great. And then Frank, you could close us out with how they can get more involved with HOLA going forward.
Yeah, great. So the easiest way is absolutely get involved with brc.org. You can volunteer. There's a whole volunteer section. You sign up to volunteer. You get on our volunteer list. You have to do an orientation, but then we will have things where every week we have different things that people can sign up for on an individual basis. You can get involved. You can get engaged a lot more to help us with our fundraising, because we need a lot of that. And you can do that by doing things like running a marathon with our team BRC. We actually have the 5-borough bike tour coming in May that we'd love to get folks to sign up to ride with us. So you can do that. That's all on brc.org. You can check it out. Email me if you want to help. Email me. I'll put my email in the chat. and we can talk about the different ways to engage and the different ways that you can support BRC. Happy to talk to anyone. Again, it's about meeting you where you're at, right? How much time do you have? How much do you want to engage? How, what are you looking to do? And we'll have those conversations together.
Thank you, Miguel. Frank?
Yeah, this was great as usual. Miguel, thank you very much. And on behalf of Mount Sinai and Ola, we want to thank you and the great work that the staff at BRC does to help this segment of the population. It's tough work. We know that it's tough work, but we appreciate everything that you and BRC does. For everyone else that wants to know how they can help, to what Miguel said, you go on the website. Know that when we send out the flyer that we start collecting the donations, the BRC link will be on there. That will take you straight to their link. So if you want to see how it is that you can get involved, what are the resources that they have, what other information it is that you need, it'll be on their website. They actually have a lot of detail on their website. It's pretty comprehensive, where they talk to you about, they give you from the board of directors to how you can help, to how you can donate, to how you can volunteer. So you'll find all of that information actually on their website. As far as HOLA, for those of you that don't know, we're an employee resource group supported by the Office of Diversity and Inclusion. We're called HOLA, which is the Heritage of Latinx Alliance. And if you ever want to know anything about our events, a simple email to Sean, myself, or Katari Villanueva, and we'll add you to the distribution. And what that does is that fills you in about all of the upcoming events that we have. And hopefully we get to see you at some of these events that we have. We have 4 pillars that we focus on every year. And one of them is community. That's working with BRC, that's working with Father Heart Ministries, et cetera, et cetera. So send us the email, get on our distribution so that you can find out some of the great work, that we're doing here. I think that's pretty much all that I have. I really don't have anything else. So with that being said, I guess we have time maybe for one more question before Miguel signs off.
Yeah, sure. I'm here.
What do you think? All right, let's see what we got here. Let's pick one here. Hold on. I saw a couple of great questions here. We got one here that says, there is nowhere for people to go. More facilities with support and affordable housing needs to be created. Okay, no, that was a comment. I'm sorry. I'm trying to see the comment, but I saw
Here.
Here it goes. BRC is an incredible organization. Does it only serve the 5 boroughs? The housing crisis exists everywhere, and in some of the wealthiest communities, such as Westchester County, there aren't organizations that provide the level of care that BRC provides. Do you know of other similar organizations in the metro area?
Great question. I don't know who handles Westchester County. BRC is a New York City-based organization. It is difficult to do an organization like ours in multi-cities or multi-states because every city has their own laws regarding shelters, regarding paying for shelters, etc. For example, BRC, one of the reasons why BRC is so effective is because New York City has what they call a right to shelter law. And you might have heard a little bit about this now because of the immigrant crisis and how that applies to incoming immigrants in the cities, the refugees.
Mm-hmm.
But basically in New York City, if you want a bed, New York City is required to give it to you. Now you don't necessarily have a choice of where you go, but if you go call 311 and you say, I'm homeless, I need some place to stay, you go to the assessment shelter, they will find a place for you based on your needs or where they think is best suited. Other cities don't have that. So if you see if you remember that movie with Will Smith and his son, that they had to get on a line to get into the local shelter, and when their beds were full, that's it. You're done, right? New York City doesn't do that, right? And so depending on the city, their laws are going to be different. The amount of money they put into it is going to be different, which is why it's very hard to have like a national or a multi-city type organization. What I would ask is that you just literally call your city hall and be like, what are the organizations, whether it's city-based or nonprofit-based, that handle homelessness, and get in touch with them.
Excellent. Thank you for that. All right, with that, I think we will end right now. Again, thank you, Miguel. Thank you for doing this. We appreciate your partnership. Everyone, look out for the flyer. We're asking, how can we volunteer? How can we help? But the first step for us is when you see the flyer, donate, because it's for a really worthy cause. Okay. Thank you, everybody. My brother, Sean Lee, I appreciate you for covering. But that's why we brothers. Everybody, thank you for joining, and have a great week. Take care, everybody.
Take
Thank
care,
you,
everyone.
guys. Good luck.
Okay.